thank you all for coming out today. It's fabulous to have such a crowd, and it bodes well because I believe that this is going to be a challenging time ahead of us for healthcare. I only want to make 3 key points for you today. The first is that there are only 2 ways to deliver healthcare. There's no magic third way that we can pull out of Europe somewhere. There's 2 ways. There's public, single payer, public system, or there's private for profit. And you can mix those different ways, but you have to make a choice. And so here in Alberta, the government's talking about having some kind of parallel system. We do not have enough doctors or nurses for the public system as it stands now. There is a critical shortage of all the resources that we need for adequate healthcare services. How on earth could a second parallel system help in any way? It would make the problem worse. A parallel private system offers executive access for a few healthy, wealthy folks who have shorter waits, and makes the wait far longer for the rest of us in the public system. Shame. It cleans off the doctors and it cleans off the healthy patients. So that isn't the solution for Alberta. And the second point I wanted to make is that we pay for it either way. So when the government says they're saving money, what they mean is that the costs are going to go up for you and I. The private system is consistently more expensive than the public system. Well, how many people here shop at Costco? Woo! No! Let's see Costco then. Why do you go to Costco? Because bulk purchasing is cheaper than paying individually one-off for small pieces. That's why pooling our resources for the public single-payer system is always cheaper than going on the private side. Private health insurance, delisting, and de-insuring services means that we individuals pay a lot more for our services out of our pockets. Right on. Vision care, after it was delisted, went up 17% in 1 year. The caps come off what the professionals can charge when a service is delisted. So chiropractors, optometrists, the cap on their fee comes off and they can charge whatever they want. So the costs start to skyrocket. Those services are much, much more adequately delivered and cheaper for us in the public system. So the first one was that there's only public or private, there's no magic third way. Second is we pay for it either way and it's cheaper through the public system. And the third point I wanted to make, and the research shows this all over, is that we can afford it. We cannot afford not to have public health care. The Alberta government today is foregoing $10 to $18 billion every year because our taxes are lower than almost every other jurisdiction in North America. Not just Canada, North America. And why? Companies aren't locating here because taxes are low. We need to have the social and physical infrastructure to support businesses in Alberta. And to do that, we need a strong public health care system. We cannot afford to forego those taxes, and any further tax cuts should be criminalized. Taxes fund our public health care system. The other thing is that the Alberta government has chosen at a time where almost every other government across Canada and in the world chose to kick in stimulus spending. The Alberta government, the one that can most afford to do it, chose to cut. It wasn't a financial decision. That decision was not a financial decision. The research shows that the government has solid resources, $45 billion in savings from the boom. They have $14 billion available right today in their capital and sustainability funds. Plenty of resources to fund healthcare, education, social services. The polling shows that the public wants the government to do deficit spending to fund healthcare. That's what the polls show. And the polling shows that Albertans want public healthcare, not tax cuts, and what Albertans get is tax cuts and healthcare cuts. Thank